Many organizations in the metro have highlighted and brought awareness to the urgent Black maternal health care crisis right here in Mississippi.
Yeah, in the state's 2024 public health report card, we rank 45th in maternal mortality and 50th for infant mortality rates here in this country.
In a two-part special report, 3 on your side, Samantha German speaks with public health leaders, advocates, and lawmakers about how the state is working to reduce these health disparities.
By transitioning from the past to the present, you will see the much-needed work being done for the future of all moms and babies here in Mississippi.
Many areas in Mississippi are known to be called maternity care deserts, a definition describing a county without a hospital or birth center. A reason places and organizations like Magnolia Medical Foundation in the city of Jackson offer an oasis.
So these are all the baby products, diapers, wipes.
Dr. Nikitra Burse works in the field of public health and says it's a divine path for her.
I was a sophomore at Mississippi State. I had another aunt who was a healthcare provider as well. She's a doctor, early on, young doctor at that time. My mother was also in nursing school.
Burse says during this time, her Aunt Kimberly was pregnant for the first time, a healthy young woman in her early 30s who shortly after her C-section started having complications.
But my aunt and mother did talk to the doctor, hey, something that doesn't seem right. Could we try this? Could we try that? And he reassured our family that everything was under control.
A family well-versed in medicine pleaded for the staff to transfer her aunt to Memphis. Burse believes their urgent cries went unheard.
She died 5 days after giving birth.
The 5th day is when Burse says her aunt was finally transferred. It was 5 days too late.
And we later found out that, she was moving into organ failure, having multiple strokes and things like that.
Before passing away, Burse's aunt Kimberly gave birth to a healthy baby boy named Braxton. Tragedy, though, would strike the family again. In 2016, Burse's sister had an extremely severe case of preeclampsia, forcing her to deliver her baby early. At just 1 pound and 1 ounce, Burse's nephew fought for 8 months in the NICU until he couldn't fight anymore. That same year, Burse's sister-in-law also died 3 weeks after giving birth. Research shows one of the widest racial disparities in women's health is Black women are 3 to 4 times more likely to die from childbirth than white women. During the 2025 session, state lawmakers passed 3 bills addressing maternal health. The first was around community health workers who can now be certified and reimbursed by Medicaid. The second was to establish paid family leave for state employees. And the third was presumptive eligibility.
And so what that means is that a mom who's going to see the doctor and is eligible for Medicaid doesn't have to wait for CMS to approve her application. She can go ahead and immediately start receiving care.
Although the bills signed into law will go into effect July 1st, Representative Zakiya Summers says more work needs to be done.
We still have hundreds of thousands of Mississippians that don't have access to health care because they make too much for traditional Medicaid and not enough for private insurance. So we have to expand Medicaid in the state of Mississippi.
Experts believe there are many factors playing a role in the high maternal mortality rate. Systemic racism is among them. A study conducted by the Maternal Mortality Review Committee found between the years of 2016 and 2020, discrimination contributed to 22 maternal deaths. Burse believes there are parallels from our nation's history, creating what she describes as a complex system for Black women navigating health care in today's society.
Coming in on the slave auction block, to me, that is the Black woman's first introduction to this, Western style of medicine. You're stripped of everything that you know and then put up in a very vulnerable position to be auctioned off and for labor in many different types of labor. And so that, to me, devalues the Black body from the start of our ancestry here in this country.
Burse noted the history of J. Marion Sims, a man once revered as the father of modern gynecology, who would practice experimental surgeries on enslaved Black women without anesthesia. possibly linking dangerous misconceptions of pain tolerance when it comes to Black women.
If I say that my pain level is at a 10, but I'm not screaming, you should still take my pain level as a 10.
Burse believes her aunt's death was preventable.
I don't believe that he went in there saying, I'm not going to treat her with X, Y, and Z care. I think that there was a level of complacency, also a level of superiority, hierarchy, that said, I know what I'm doing, and so I'm going to treat this as such.
Braxton will be 22 in October.
And he's growing up, and, a lot of times you can't help but to think, what would she think of him now, and how would she parent him, and, how would she love on him? And, we try to fill in those gaps, but nothing replaces that.
Answers a mother would only know, whose presence may be gone, but whose love never left.
And tonight at 10 in part 2 of 9/11 Black Maternal Health Care Crisis, Samantha speaks with the state health officer and health leaders in the Delta.
They talk about the issues they face when it comes to drive times during health emergencies and how the lack of funding for rural hospitals forced many to shut down.
All right.